I've talked about the threat we're facing from this terrible, terrible virus. I haven't shied away from the hard facts. The truth is, the situation is extremely, extremely serious. Right now, our best defense is to stay home, self-isolate, and don't go out. It is a matter of life and death. Over the next little while, we will all have to make some very, very difficult decisions. And you deserve the same information I have. You deserve to see the same data that I see when I'm making decisions. You deserve to know what I know when you're making decisions for yourself, your family, and your community. And that is why I've asked our medical experts to provide a full briefing to the public on where this could go. We'll walk through Ontario's story. Tomorrow, our top doctors will provide an update on where Ontario was, on where Ontario is, and where Ontario could be. Over the past few weeks, we've shown we will not hesitate to take every step necessary to slow the spread of COVID-19. We were the first province to close schools, the first to close non-essential workplaces, and we've asked you to stay home. We've limited gatherings to a maximum of 5 people. But avoiding the tragedy that we've seen in Italy and Spain will be entirely up to all of us. It'll be up to us to follow this advice and do what's necessary. We all have a part to play in combating the spread of COVID-19. And for you to make the best decisions for you and your family, you need to have the best information. And I know many people will find this information hard to hear. A lot of what we're dealing with right now is hard on people. The new reality is hard. What we're seeing happening to our seniors in our long-term care homes, what we're seeing happening to our neighbors is hard to process. It's hard to comprehend, and it's hard to deal with. We know the sacrifices many of you have made to stay home. We know all of this is taking a toll on mental health of Ontarians. Daily routines have been broken, and the feeling of being isolated is real. We know this is very, very stressful, and we want to help. Today, we're investing $12 million to expand online virtual mental health supports for you and your family. We've partnered with incredible organizations like the Kids Helpline and Bounce Back to provide you the support you need now in a way that is safe for you and everyone around you. We also know the mental and physical strain that our frontline workers and our first responders are facing. They're working long hours. They see tragedy every single day. They're making really, really tough decisions. So we're providing dedicated therapy to help them through this challenge. On Monday, we launched a new mental health wellness program, which will provide 24/7 mental health supports to active and retired OPP personnel. We've also hired new psychologists and other mental health workers to support our men and women in uniform. We know staying home and practicing physical distancing is the right thing to do. It's what we all have to do to stop the spread of COVID-19. But it can't mean disconnecting entirely from friends, neighbors, or loved ones. Social isolation can be hard on people. And my message to everyone watching today is this: you're not alone. We're listening. We care. If you're struggling, please reach out. Talk to someone. If you know someone, who may be struggling, talk to them, pick up the phone. During these difficult days, we all need to stick together. Let's keep the Ontario spirit alive. I want to thank you, and God bless the people of Ontario. I'll pass it over to Minister Tibollo.
Thank you, Premier. Our province, in fact, our whole world is in the midst of an outbreak almost unprecedented in our province's and our country's history. These are truly extraordinary times. When people are experiencing something new and unfamiliar to them, that can cause many people to experience stress and anxiety, among other mental health challenges. And when it is on the magnitude of this current outbreak, then those stressors can become a lot for a person to manage on their own, even with the support of their family or friends. Notre Provence, en fait, notre monde entier, est au milieu d'une flambée presque sans précédent dans notre province et dans l'histoire de notre pays. Lorsque les gens vivent quelque chose de nouveau et ne leur sont pas familières, cela peut provoquer chez beaucoup de gens du stress et de l'anxiété, entre autres problèmes de santé mentale. That is why I am so pleased to join the Premier and the Deputy Premier here today to announce this $12 million investment. These services are going to help the many Ontarians that are experiencing anxiety, stress, or other mental challenges by increasing access to online and virtual supports during these unprecedented times. Just as importantly, it will provide alternatives for Ontarians who can't access the regular in-person counseling supports because they're respecting the direction to remain at home to stop the spread of COVID-19. This funding is going to help people across the province get the support they need by ensuring mental health agencies have the necessary resources to hire and train more staff, purchase necessary equipment, the most appropriate technology, and additional licenses. The funding will help to immediately expand services on a wide range of platforms based on evidence-informed cognitive behavioral therapy. Our government also recognizes that in these challenging times, we must also look out for those who put themselves at increased risk due to the demanding nature of their work. Having served as Minister of Community Safety and Correctional Services, I'm well versed in the important and often demanding work performed by the dedicated officers and staff within the Ontario Provincial Police. It is why I'm firmly in support of the decision made by the Solicitor General to invest $2.6 million to hire new psychologists and other mental health clinicians who will provide OPP personnel with the mental health supports they need to deal with the challenges inherent to their jobs. These new psychologists and mental health workers will provide clinical services to all members of all ranks and make referral to external services if needed. Our investment will enable the development and delivery of mental health supports and programming tailored to the unique needs of the officer to meet geographical, cultural, and even specialized needs. These new workers will facilitate education programs to both uniform and civilian members to reduce stigma and promote resiliency and to help them get the help they need when facing mental health challenges. Finally, they will serve to provide guidance in peer support programs. Our government recognizes that many Ontarians are experiencing increased anxiety because of COVID-19 and are worried about their health, the health of their family and friends, and the future of their livelihoods. That is why our government continues to work with our partners across the mental health and addiction sector to fund these valuable services while ensuring Ontarians receive the high-quality care they expect and deserve. I'm now going to invite the Deputy Premier and Minister of Health, Christine Elliott, to say a few words. Thank you.
Thank you, Michael. Premier, our first priority during this outbreak is the health and well-being of every Ontarian. Our seniors, particularly vulnerable to the consequences of COVID-19, being urged to stay at home. Young Ontarians, facing unique and growing stressors as their daily routine of school and extracurriculars has been turned upside down. And of course, the brave men and women fighting COVID-19 on the front lines of our healthcare system, and the growing toll this battle takes on their mental health and well-being. Nothing matters more than their safety, than the continued health and well-being of all Ontarians. On the advice of the Chief Medical Officer of Health, Ontario has taken decisive action to stop the spread of COVID-19. We've closed schools and parks and banned public gatherings of more than 5 people. And we have ordered the closure of all non-essential workplaces. Most of all, we have been clear about the need for all Ontarians to stay home. Doing so is the only way we can stop the spread of COVID-19. It's the best way to save lives. While critical, I know that staying home is no small ask. There are many for whom isolation brings unique challenges for their mental health. Anxiety, depression, a growing sense of loneliness or helplessness. These challenges cannot be diminished, nor will they. An outbreak of this magnitude is new territory for all of us. We all want nothing more than to be with our friends and neighbors at a time like this, to be able to share our experiences and comfort one another. As we continue to protect the physical health of Ontarians, we must also acknowledge that their mental health is equally as important and take action to protect it. With today's announcement, we will bring more help and provide Ontarians with more supports they need to stay mentally healthy during these challenging times. We want our families, our children and our parents, our frontline heroes to remain safe, healthy, and strong, because we still need everyone, all Ontarians, to remain steadfast in their commitment to fighting COVID-19. We need every Ontarian to do their part. That includes continuing to stay home. I really can't stress this enough. Lives depend on it. There is no question that each one of us, in some way, has been impacted and affected by this outbreak. In many cases, the impact has been significant. But we will get through this. We will defeat COVID-19. As we continue our fight, we will do everything we can to keep Ontarians safe. We will do everything we can to protect your physical and mental health. To every Ontarian who may be struggling at home, please access these services. Reach out for help. Nothing is more important to us than your continued well-being. Thank you.
We'll go to the phone line for questions. First question.
First question comes from Robert Benzie from the Toronto Star. Please go ahead.
Good afternoon, Premier. I'm just curious, you've been hinting for days that we are headed toward a mandatory stay-home order. Why not just go ahead and pull the trigger on that? Are you waiting to tonight's First Minister's meeting with the other premiers and the Prime Minister to determine that?
Well, Rob, everything is on the table right now. And in reality, we have to make sure that the certain essential services are open, grocery chains, making sure we have food on the table, making sure pharmacies are open. So again, everything's on the table right now.
So when you say that you're going to expand the non-essential businesses, does that mean we're going to see perhaps the closure of things like the LCBO, beer store, cannabis retailers, pet shops, things like that?
Well, Rob, we're reviewing that. That list will be adjusted, and you'll hear from us in the next short while.
Next question.
Next question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Premier, my apologies for that. How detailed will you ask the doctors to be as they update people? Will we be seeing a number of scenarios out there to give people an idea of what will happen if we do nothing, what will happen if we follow all the rules, what will happen if we follow just some of them?
Yeah. So, Brian, that's a good question. And right from day one, when it started, I said I want to be transparent. I want everyone to know, one, where Ontario was, where we're at now, and where we could be if we don't take further steps. It's going to be a real sobering discussion, I should say. It's going to be stark. It's going to be stark, and I'll answer the question before it comes from the media. Why not 3 days ago? I think I've answered this, but I'll answer it again. The Chief Medical Officer of Health, with everyone coming from abroad back into Ontario and in Canada, the snowbirds coming in, we wanted to have a very clear measurement that he can measure until we can have an accurate modeling system that we can show the public. If we would have done this, let's say 4 or 5 days ago, it wouldn't have been accurate. Now we have more data. They wanted a week from the time people were coming back. Now he has proper measurements, and I just want to be very clear. I'm always going to be transparent. I want to make sure the people of Ontario know what I know and the reason why we're making decisions and decisions in the future, and giving them the opportunity to make decisions for their families, their communities. So I'm going to just be straight up with people, and just tell them exactly what I know. No beating around the bush, no holding back figures. I want to be right up front. It's going to be hard for some people to hear, but as Premier of this province, I have to be up front with people, and I'm going to be. And people will see some really stark figures tomorrow.
And Premier, you've talked an awful lot about Ontario spirit and working with manufacturers to bring more supply back that we can make here. Yep. Is this perhaps after we're through this pandemic? Is it time to look at bringing the supply chain back to Ontario, back to Canada on a more permanent basis rather than wait for the next emergency?
I truly believe that. Coming from a manufacturing background myself, there's certain things that we can bring in from overseas, but if someone said, what is one thing? And we've learned so many things, all of us together. If there's one thing that we won't be put in this position again, is PPEs. Relying on the rest of the world to send PPEs in. We're going to start manufacturing them. We're going to encourage hospitals to support these manufacturers. We can never, ever be put in this position again that we're relying on countries around the world to support us with PPEs when everyone else is in a crisis. We have the manufacturing might. We have the manufacturing capabilities, ingenuity, the engineering. We are an economic powerhouse. And again, people have asked me, what have you learned since you took office as Premier? I've crisscrossed this province. The ingenuity and the people, the technology. We have the brightest people in the world, bar none, right here in Ontario. We have the natural resources. We have the capabilities. We can't rely on anyone else moving forward, no matter if it's the ventilators or N95s, face masks, gloves, those essential items. We need to make them here in Canada, and we're the manufacturing engine of Canada. It's not just Ontarians that are waiting for us. I'm getting on the phone with all the premiers, and the number one question I'm going to get, when are the ventilators coming? They're relying on us, and I just can't stress it enough to people, especially, and I want to thank Linda from Linamar and Kim over at O2. People's lives are depending on us making sure we get these ventilators, no matter if you got to work 24/7. We're up against it right now.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi, Premier Doug Ford. Thank you so much for opening up the data for all Ontarians. Day by day, as we've been watching you at these news conferences at that podium, I think the entire province can see the worry in your face. And that undoubtedly gives us a bit of a reflection, maybe, of the information that you're seeing. Can you give us a sense, Premier, of what we should be preparing for tomorrow?
Well, the exact figures, Colin, I can't give you the exact figures. I'd rather rely on the medical professionals. and some of the best in the world we have around the table. They're going to tell the public exactly what they're telling me. And it's going to be very clear that where we were, where we are now, and where we could be if we don't change our habits, if we don't follow the chief medical officer's protocol. I just want to. It's going to be stark, as I mentioned, and hopefully people that we saw last weekend, because there's going to be some beautiful weekends coming up, and maybe after they see these figures, and we're going to be the first government to do this, to roll this out and show people exactly where we are. I just do not believe in holding back figures in this crisis. I've mentioned it to our cabinet, I've mentioned to our team. We have to be fully transparent with the people of Ontario, no matter how hard it is. They have to know the reason I'm making decisions, and that will be a real wake-up call to folks that we don't want to see the beaches and the parks packed, even though we've put restrictions now. Stay at home, protect your parents, your grandparents, put an iron ring around the long-term care as we're doing. We're in a very, very serious situation right now, and I can't be more upfront and honest than I am right now talking to people.
Thank you. And I have a question for Health Minister Christine Elliott. So, Minister, frontline healthcare workers are being redeployed to where they are needed most. So that means a number of things: having to come in close contact with patients, having to worry about their own personal health, and of course, having to separate themselves from their families so that they don't infect their own family should they get sick. If a healthcare worker is told that they have to redeploy, can they refuse? Can a healthcare worker say, no, I do not want to be redeployed? And are there sanctions in place if that happens?
Well, we have employed that provision, working with the employee representatives who've been extremely cooperative and understanding about the need to do this, because we don't know exactly where the COVID-19 hotspots are going to be. But we have said that with respect to hospitals, for example, before any redeployment is done by a hospital, that we are asking them to please speak with their employee representatives locally to understand who is willing to go forward with this redeployment, because there are volunteers that want to do that. The hospitals aren't required to act as a result of the employee representatives' recommendations, but it is understood that this will make things go more smoothly, and that we will get the right people in the right places. So there is work that goes on has gone on between the Ontario Hospital Association and with the Unifor, with SEIU, with ONA, and so on. They are being very cooperative, and I anticipate that we will end up with people who are prepared to be redeployed going into those alternate positions.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi there, thank you.
Thanks.
I have a question about long-term care homes. Premier, we know that there's a shortage of frontline workers in these homes, such as personal support workers and nurses, and these are the people who are caring for our most vulnerable in society as they deal with these devastating outbreaks of COVID-19. What is your government going to do to address the shortage of workers, and especially to improve the working conditions of these essential workers? Will the government take control of staffing, as we've seen in BC? Will they boost their wages, as we are expecting Quebec to announce, give additional benefits or full-time jobs to PSWs and other employees?
Well, before I pass this over to the Minister of Health, sorry, we're going to do everything we can to make sure they have proper equipment, to feel secure. I know we've engaged with the colleges on the nurses that we're going to graduate in another month or so to get them into the field, supporting them. I know Humber College had 400 nurses available to go in there and support the system wherever they need them. So I want to give a shout out to the people at Humber College and other colleges and universities. across our province. But I'll pass the balance over to the Minister. Thank you.
Well, I think the most important thing first is that we make sure that all frontline healthcare workers in hospitals, home care, and long-term care have the personal protective equipment that they need to remain safe and healthy for themselves and their families, and of course for their patients or residents. We also know that we have to build up the supply of people who are going to be able to work on the front lines. So we have a special table at the command table dealing with human resources. They have opened a line for people to call and to volunteer to serve. We have had over 10,000 people already who have come forward. Some of these people are retired nurses, some are medical students, some are volunteers that just want to help in any way that they can. So we are working on a very expedited basis with the regulatory colleges to make sure that retired nurses, for example, can be brought back into the workforce. We want to use the medical students to help us with the contact tracing and follow-up. So there is room for a lot more to happen in terms of long-term care. And similar to the order, the emergency order that was directed with respect to the redeployment of hospital workers, a similar order has been signed with respect to the redeployment of workers in our long-term care homes. So we want to make sure that we have the right resources, that we have the right protections for people, and that the residents, most significantly, that we can build that iron ring around them to protect them and make sure that they are able to stay healthy through this crisis.
And can you just address, Minister, if you will be boosting wages, and also how many outbreaks are there at hospitals right now involving healthcare staff, and why isn't the government tracking this?
Well, it's not something that we're looking at in terms of increasing wages at this point. We haven't heard that from the people who are on the front lines. What they're more concerned about, frankly, is having the personal protective equipment to remain safe. So that's what we're focusing our attention on. And we know that some frontline staff members have become ill. We want them to of course, become well, but they need to self-isolate for 14 days, just as everyone else does. That's why we're putting this health human resources strategy in place, so that we can provide replacements for them while they're away. And in some cases, they may need some respite as well. We know they're doing really, really difficult work right now, and we want them to stay both mentally and physically healthy. So we're addressing both of these issues with our strategy.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hello, Premier. This question is for you.
Okay.
Hi, Premier.
Hi.
You mentioned that you are the first government that will be releasing these modeling numbers. Just a couple of hours ago, the Prime Minister refused to release them. Are you breaking ranks with the PM and other premiers?
I would never break ranks with a PM or other premiers. That's going to be up to the Prime Minister to make a decision. He's responsible for the country. I'm responsible for the people of Ontario, the 14.5 million people. And since I've started, I said I'll be transparent, and I'm going to be transparent on every single item that we have. I have to make sure that the people understand the situation that we're in. I want to make sure that communities and family members right across this province understand the situation we're in, and have the reality of how serious this is. And by no means would I break ranks with any of the premiers or the Prime Minister. It just that's going to be up to the Prime Minister to make a decision on when he wants to release any of the modeling that he has seen. We're gonna release it tomorrow, because now we have a better idea after everyone coming back home where we're at.
Okay. My other question for you is about restaurants. A report came out today saying that they are in dire straits. I've been speaking to restaurant owners, and many say they're not going to last another month. They'll go bankrupt. is there any financial help that you can give restaurants to save them? Because, you know, more than 300,000 jobs in Ontario, restaurant jobs, hospitality jobs have been lost. And if all these businesses go under, after all this is over, there will be no, it will hinder recovery because there will be no jobs for people to go back to.
Yeah, my heart breaks for these restaurant owners. A lot of them are small, family-run companies. 1 in 10 may not reopen, and I imagine it would probably be higher than 1 in 10. And with the federal government, I know they're mentioning about a $40,000 loan. That is appreciated, but that in some cases that might be 2 months' rent. I'm speaking for downtown Toronto, for example. The rents are astronomical, and we appreciate the offer from the federal government. We're allowing companies to defer taxes and payments, and I encourage people to work with their landlords to make sure that they're able to stay on their feet. But it's very, very difficult. We'll sit down with the finance minister, but that's a massive amount of businesses, and on the leases too, helping out with landlords and leases. To put it into perspective, there's 1.2 million leases in Ontario. Those are staggering figures. Even if you put $1,000, that's 1.2 billion. You put 10, that wouldn't even, you know, as a drop in the bucket. And it would be billions and billions and billions of dollars to cover leases. But I'll make sure I mention this at the COF meeting today, and with the conversation with the Prime Minister this afternoon. I will emphasize this and see if we can get more funding for restaurant owners, because it's so tough on these people. You know, usually most restaurants are family run. They have staff, and some restaurants are much larger, but it's very, very difficult on these people. My heart breaks for them.
Next question.
Next question comes from Travis Dunrush of Global News. Please go ahead.
Hey there, Premier. Good afternoon. Do you think that this data, by what you're saying, is going to be really difficult to hear and digest, will make people get it that don't get it right now? I mean, this weekend we saw Woodbine Beach packed. Yesterday there were pictures of Sunnyside where the parking lot was absolutely jammed. And why do you think some people are still being completely irresponsible when it comes to staying at home?
You know, Travis, it's a great question. It's just I can't comprehend why some people aren't getting it. They may think it's not going to happen to me. Well, it can happen to anyone in the world, and it's so important. Not only, you know, doing that is unsafe. You could say selfish, because God forbid they get COVID-19 and all of a sudden they're touching items that people will go by and touch, and then it just spreads rapidly. And for them not to listen, and then let me go to the other side. Vast majority of people are listening. You get small groups that just refuse to listen. It's disappointing, to say the least, and hopefully tomorrow there'll be a real wake-up call, and that's why we need our our bylaw officers, our police, to be out there, not to put down a heavy hand. I just don't believe in that, but to cooperate. Most people are, like the 14.5 million people in this province. They're doing their best. They're all stepping up. They're doing a great job. But then you see some people that just don't want to listen. It's disappointing.
And this question is for you or the health minister. The president of the Ontario Council of Hospital Unions said today that of the workers that they've surveyed, over 90% don't have confidence in the province's ability to protect them. He also said it's cruel and unfair that some frontline workers have access to COVID-19 protection and others don't. What do you think of that figure, and would you recommend frontline healthcare workers that aren't protected right now refuse unsafe work?
Well, again, we're doing absolutely everything we can. I was on the phone late last night with a deputy Prime Minister, I know there's a plane that's come in with protective equipment for personal protective equipment for the frontline people. I said, you know, I'll be at the airport on the runway waiting for this to land and start loading the trucks up. We're in need. There's no secret. We're in need to make sure that everyone gets the equipment that they need, and I'll do whatever it takes to make sure we have this equipment. But I'll pass this on to the Deputy Premier.
So we are working very hard 24/7 to find the personal protective equipment that people need, that we want to make sure that all people working on the front line are healthcare workers, but also making sure that our frontline first responders, firefighters, police officers, paramedics, correctional service officers as well. We want to make sure that everybody who is in a close contact with the public has the protection that they need. But the Premier is right. This is an international competition for personal protective equipment. It is encouraging to know that the federal government has received a first shipment of goods. We are waiting to receive Ontario's share, and they will be distributed quickly because we need our frontline providers to have that protection, and we're working 24/7 to get it.
But do you think that they should refuse unsafe work, though, if they aren't protected?
You know, I have incredible respect for the people who are working on the front lines during this crisis. They are stepping up, whether they have the equipment that they would want to have in an ideal situation or not. We haven't heard of any indications where people are refusing to work because they know that Ontario needs them. They know that their patients need them. And all of us in Ontario are very, very grateful for the work that they're doing.
Next question.
Next question comes from Allison Jones from the Canadian Press. Please go ahead.
Hi, Premier. I just wanted to clarify on the data briefing tomorrow. Just hoping you can be specific on what we'll see. I know you're not going to give exact figures, but you say we'll see where we've been, where we are, and where we're going. Just specifically, does that mean we're going to see the possible numbers of cases and deaths in various scenarios?
Yes, I've asked them to be as transparent as whatever they've shown me. I want the people to see the exact same figures, and yeah, they're going to show figures.
Right. And yes, sorry. And just on a slightly different topic, the Prime Minister said today that he's not quite at the point of issuing a national stay-home order, essentially punting it to the provinces, saying he's leaning on the restrictions that provinces have been putting in place. I know you've said everything is on the table, but does that put a bit more onus on you to bring something like that in?
Well, I'm really, really relying on the people of Ontario to work with us. And I know the last question there, you know, we heard that some of the parking lots were packed. We're just asking people to work with us. That's the last thing someone wants to do is you know, the police marching around telling people to, you know, stay in their homes. I just don't believe in that. We're responsible. We're Ontarians. We're Canadians. Do the right thing. You know what's responsible. You know what's not responsible. So please, just stay at home. I understand it's tough. As I said, people can go a little squirrely staying in a confined area. I understand that. I do. But please just do the right thing for your neighbors, your loved ones. You have to do it. Please don't think it's not going to happen to me. Just don't think that. Think that you're going to help someone. You're going to help your family members. Because as soon as you contact someone, COVID-19, and you have it, you want to go home and hurt your children? I don't know anyone who wants to hurt their children or hurt their parents or their grandparents. I don't know anyone who wants to do that. So just do the right thing. And maybe the figures that they'll see tomorrow will be a real wake-up call for a lot of people.
Next question.
Next question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Thank you very much for taking our questions. Just to follow back a little bit on this, there is a little bit of a shift here, Premier, yesterday when you talked about that you didn't want to prompt panic when you were asked about projections yesterday. So I'm curious, I know that you obviously want this to be a wake-up call, especially to those who are disregarding social distancing rules, but how do you ensure that there isn't panic when the numbers come out tomorrow? Is that going to happen by how it's given by Dr. Williams and others? Is it by the reporting by the media? How do you ensure that panic doesn't happen?
Well, Lucas, what I've said the last few days, I don't want to release numbers that just aren't accurate. There's too many models out there. A week ago, Chief Medical Officer have asked us to give them a week and their team a week to really get some accurate numbers and account for everyone abroad and snowbirds and so on and so forth. But we have two options. There's actually three options in life when you make a decision. There's one, that you make a decision and you're right. Two, you make a decision and you're wrong and you correct that decision. Number three is you don't make any decision. And that's the worst thing we could do as a government, as a people. We have to be transparent, no matter how tough the message is going to be tomorrow. It's the fair thing to do to people in Ontario. They have to know where we stand, and we're going to tell people exactly what we know. The figures I see, you're going to see the exact same figures and the same modeling that we've seen.
And you've constantly said that you have all the confidence in the world in the people of Ontario. When they see those numbers in the various scenarios that they're coming in, how confident are you that they're going to take them seriously and they're going to respond appropriately?
We have some of the strongest, most resilient people anywhere in the world right here in Ontario. A lot of people that have come here, Ontario, new immigrants that have come here, have seen a lot of stark things and tough things where they've come from. Not all, but a lot have. And I have the confidence in the people. They're going to see the numbers. They're going to understand what we need to do. They're going to understand that we have to follow the protocol that the Chief Medical Officer has put forward. And we're going to band together. We're going to stick together, and we will. We're going to get through this. As sure as I'm standing here, we will get through it. We're going to go through turbulent waters, but we've got this, and we're going to go through it, and we're going to make sure at the end of the day we're stronger and healthier than ever. But I can't sleep at nights thinking I have something and I'm not being transparent. I can't do that to people. I just got to be upfront with them and tell them exactly the figures. I have confidence and faith in the people of Ontario.
Okay, this will be the last question.
Last question comes from Matthew Simard at CBC. Please go ahead.
Hi, for the Premier. There's now border controls between Ontario and Quebec in the Ottawa region and in Northern Ontario. First of all, did you get a heads up from the authorities in Quebec about these new measures? And are you going to ask the OPP to start doing the same, setting up checkpoints?
Well, we're going to. That question is going to come up when I talk to the Prime Minister and the other premiers. I think the federal government needs to make a decision on what they want to do when it comes to this. Let's use Ottawa, for example. I got a message from the mayor, a great mayor, by the way, and they're so intertwined, Ottawa and Quebec. Gatineau, people may live there, work in Ottawa, vice versa. They're going back and forth. You see on the news the lineups of people trying to get through. On the other end, over by Manitoba, we have Minister Greg Rickford's riding Kenora, right on the Kenora, I should say, right on the border, and there's goods being held up all the way down the highway. So I think the federal government needs to come up with a national strategy, what we're going to do, and give us the resources. If the decision's made to close the borders to the exception of goods and services and people working in both sides of the border, then let's have a strong strategy, but give us the resources. Because right now our OPP are stretched thin, and we need to get the OPP to focus on what they do best every single day, And that's not standing at the border of one end of Ontario or the other end, or the southern border as well. So I look forward to hearing the national strategy from the Prime Minister and what the plans are for that. But we'll inform the people tomorrow in our next press briefing.
But are you looking right now at travel restrictions for some region in Ontario, like it's happening in Quebec right now?
I apologize. The first part of that, I didn't hear you.
Are you looking at travel restrictions for some region?
Some friction? I didn't hear. I'm sorry.
Travel restrictions.
Oh, restrictions. I apologize, my friend. Maybe my hearing's going on me. Again, we have to rely on the people. I would recommend don't travel. Now, Ottawa is different with Gatineau. Like, so many people work for the federal government that live in Quebec, and they cross the border every single day. So unless it's for business or essential services or essential items, no, I wouldn't travel. I just would not travel. Stay at home, stay inside, and that's the best thing to do. Before we wrap this up, you know, I've never asked this before, but you know, we pride ourselves, our family, my brother, myself, on returning calls. And we have somehow my numbers out there, and I'm getting hundreds and hundreds of messages and calls, and I appreciate people calling to check up on myself and my family. We're so grateful. And I apologize if I can't get back to you. It's not personal, because I pride myself on getting back, but I have to, my friends, I have to be focused 100% at this task. So please don't be offended. I get comments back on my messaging. Well, you know, why aren't you returning my call? The truth of the matter is I'm getting hundreds a day, and I just can't do it. So please, it's not personal. We will be in touch. My family is well. I am well, and I'm very grateful for you checking in. But unless it's an emergency, your family is an emergency, we'll chat later on. I've never said that, but I think to the point I have to say that, and I apologize. But thank you, everyone, and God bless you. Thank you.